Hey everyone, and welcome back. After pregnancy, every expectant mother is concerned about how her baby is doing and how the baby is growing. Throughout the pregnancy, different symptoms appear which can help you understand whether the baby is healthy or not. So in today's video, I will discuss the symptoms during pregnancy that may indicate your baby is not doing well. Let's get started. Number 1. Bleeding. After conception, a woman's body usually increases the production of the hormone HCG, which stops her monthly period. That means periods should stop after pregnancy begins. If bleeding occurs anytime after a positive pregnancy test and before delivery, it is a cause for concern. If bleeding occurs before 20 weeks of pregnancy, it could be an early sign of miscarriage. If bleeding occurs after 20 weeks, it could indicate preterm labor, or labor starting before its proper time. Additionally, bleeding during pregnancy can be caused by issues related to the placenta, which can lead to oxygen deprivation for the baby. Remember, you should not have periods during pregnancy. Any bleeding is a sign that something might be wrong with your unborn child. Seek advice from a gynecologist without delay. Number 2. Abdominal pain. Mild abdominal or back pain is quite common during pregnancy. Occasional light pain that resolves on its own is usually normal. However, persistent pain in the lower abdomen or lower back, or pain that gradually increases, could be a warning sign. Normally, after conception, the embryo implants into the endometrium, the inner lining of the uterus. But if the embryo implants outside the uterus and starts growing there, it's called an ectopic pregnancy, a serious and life-threatening condition that causes severe abdominal pain. It could also be an early sign of miscarriage. If you experience severe abdominal pain during pregnancy, you must consult a gynecologist. Getting an ultrasound scan within the first 3 months of pregnancy is best to rule out conditions like ectopic pregnancy and to check on the baby's well-being. Number 3. PROM, or premature rupture of membranes. Inside the womb, a baby grows within a thin, fluid-filled sac called the amniotic sac. This sac is filled with amniotic fluid, which protects the baby from infection and cushions them. Just before delivery, the sac normally breaks and water comes out, commonly referred to as the water breaking, signaling the onset of labor. However, if the amniotic sac breaks before 37 weeks of pregnancy, it is called preterm PROM. If a pregnant woman experiences her water breaking, which can be a gush or a continuous trickle of fluid, especially between 7 to 9 months or earlier, it is a serious issue. This can lead to infections for both mom and baby, or even trigger premature delivery. The good news is that with timely medical attention and proper care, such as antibiotics or steroids to help baby's lungs if delivery is imminent, this problem can often be managed to achieve the best possible outcome. That's why it's important to track your pregnancy week by week and be aware of what's normal for you. If your water breaks before 38 weeks, or if you suspect it has, consult a gynecologist immediately. Don't wait. Number 4. Less fetal movement. Fetal movement, those precious kicks, flutters, and rolls, usually begins to be felt after 5 months, around 20 weeks of pregnancy. Although some women, especially those who've been pregnant before, may notice it earlier, while first-time moms might notice it a bit later, say around 24 weeks. If you don't feel any movement at all by 24 weeks, it's crucial to inform your doctor. This could be a sign of intrauterine growth retardation, IUGR, which means the baby isn't growing properly, or other issues. As you move into the 3rd trimester, between 7 to 9 months, monitoring your baby's movement becomes very, very important. A significant decrease or absence of movement can be a warning sign that the baby is in distress. Problems don't usually happen suddenly without any prior indication. A consistent lack of movement can be that warning. A good way to check is to lie on your side after eating and count if the baby moves at least 4 to 5 times in 1 hour. It's recommended to do this kick counting session after each main meal, so about 3 times a day. If you notice significantly less than 10 movements in a 2-hour period, or a noticeable, sustained change from your baby's usual pattern, you need to consult a gynecologist immediately. It could be a critical warning sign that requires urgent attention. Don't ever hesitate to call if you're concerned about your baby's movements. Number 5. Severe headache and blurred vision. During the last 3 months of pregnancy, some mild swelling in the legs and feet is pretty normal for many women due to fluid retention and pressure from the growing uterus. However, if you develop a severe or persistent headache, especially one that doesn't go away with rest or simple pain relief, and it's accompanied by changes in your vision like blurriness, seeing spots, or light sensitivity, this is a major red flag. In some cases, blood pressure can increase significantly during pregnancy, leading to a serious condition called preeclampsia. Other symptoms of preeclampsia can include significant swelling in the hands and face, upper abdominal pain, and rapid weight gain. If a headache lasts more than 24 hours and is coupled with these vision problems or other preeclampsia symptoms, you must seek medical help as soon as possible. Preeclampsia can be dangerous for both mom and baby if not managed promptly. So, to recap, if you notice any of these 5 signs during your pregnancy, any bleeding, severe or worsening abdominal pain, your water breaking prematurely, a significant decrease in fetal movement, or severe headaches with blurred vision, it may indicate your baby is not doing well or that you have a serious pregnancy complication. In such cases, always consult a gynecologist or your healthcare provider immediately and get an ultrasound or other necessary checks done. Early intervention can make all the difference.